So now Virender has a question. My way is to read the paragraph first, understand it, then close or hide the resource and write it down. Write it from your mind and understand. This is exactly how we do it, Virender. Very good. This is exactly how we avoid plagiarism. Now I think you guys are pretty clear and you know this. So the phase one is the topic selection. Once you decide topic selection, then you decide the research question. Now, what kind of research question? If it's a therapy-based research question, you will need to rely on clinical trials. If it's a harm study or if it's a risk factor related, then you will have cohort studies or case control studies included in your paper. So what kind of research question you have will actually help you decide what kind of studies you will keep. But now another question, can you have a research question where you can have mixed kind of studies? Yes, there's a mixed design as well. Systematic reviews nowadays are also written with mixed study design, that you can have a clinical trial, you can have a cohort study, you can also have five cross-sectional studies, six clinical trials, and three cohort studies, prospective, five cross-sectional, five case control, and collectively you have written a paper. This kind of paper can never become a meta-analysis because it's a heterogeneous paper, purely heterogeneous paper. That's a benefit. I wanted to conduct another session on research question. Let's do that, guys. Next session should be again on research question. That is one of the toughest things for many students. But remember, the good news is you don't actually need to worry about a research question in traditional review. Your research topic is your research topic question. Easiest thing in the world to write is a traditional review, just like an essay. The only difference is you will give a reference. You write essay from your memory, but you write traditional review by looking at other people's papers, and you give a citation. Same thing with systematic review. You write from other people's papers, but in systematic review, you explain how you collected data. That's it. And that's a mandatory part of a systematic review. Okay, so Sana has a question. What are some of the qualities, features of best systematic review your students have done? Methodology. Wonderfully done methodology. Everything was done according to Prisma checklist. And I'm so proud of my students, especially this year, the way our students have performed. Unbelievable levels. It makes me feel so satisfied that if you see the papers that have been published this year by our students, systematic reviews or even traditional reviews, they are of a whole new level. They're of a whole new level. They all wrote a wonderful methodology, everything according to Prisma checklist, Prisma guidelines. They drew Prisma flow diagram. They made sure every point was discussed in the method section and results section. They checked the duplicates, they removed duplicates, they did the screening, they did the quality check, nothing was left. Okay, so now, what according to you made them good paper? Methodology. If it's a systematic review, then the methodology. If it's a traditional review, then the conclusion. Actual method and results, everything is in the discussion section. So if it's a traditional review, then I will see your level of your discussion section. Have you written the limitation section? Have you explained everything really well? And then the conclusion, what exactly is your paper suggesting? If it's a systematic review, the first thing I see is your method and results. I'm not concerned about anything else. I just look at the method and results. Is it really systematic? Does it make sense? Now, Darwin has a question. Is it okay to use different search strategies in different websites? Is it okay to use different search strategies in different websites in a systematic review? For example, I can use Mesh and PubMed, but exactly. This is how, Darwin, this is how you write a systematic review. You cannot do Mesh on Google Scholar. And your search strategy and keywords will be different on PubMed and different, can be different on PubMed Central, can be different on PubMed, and can be different on the Web of Science. Absolutely. So remember, guys, Sana has a very valid question. So remember, if you're writing a systematic review, I want your full focus to be on method and result section and your Prisma flow diagram. If you're writing a traditional review, I want your full focus to be on discussion section. And therein, you are right. Yes, search strategy varies from one database to another database. Don't call them websites, call them databases. You are a scientist now, you're a researcher now, so use research language. These websites are known as databases. PubMed is a database. Medline, PubMed Central, Web of Science, Scopus, Embase, Cochrane Library, PsycInfo. All of these are websites, but we don't call them websites. We call them databases. So now Sania has a question. Can you please explain mesh? Yes, you will get the training on mesh second week. Stay patient, Sania. You will learn mesh and you will be an expert in mesh strategy. I promise. By the way, I have some videos. I'll send you the videos today. Very good, Farhana. Very good, Farhana. Database is one word. Database is one word.